Hello and welcome back to the Patient First podcast. I'm your host, Dr. Bryan Laskin, and I am very excited that you're here, where we, of course, put patients first and we put dentists 10th. More on that in a little bit. I really want to talk about the profession of dentistry today and how amazing it is. So, if you are a dentist or if you work in dentistry, I want you to put aside that bad day that you had yesterday or that bad month that you had or the bad year in 2022 because the ADA News just recounted the US News and World Report's latest publication of their best jobs, and the ADA News published a summary of it in the January of 2023, and it really talks about how great of a profession that we have and focuses on that. But I also want to address one aspect of it that I might disagree with a little bit. And if you're a dental patient looking to seek dental care, this directly affects you. I mean, we talk about it a lot on this podcast, but in dentistry, somewhere, depending on the study, 60 to 80, 60 to 80% of adults in the US have dental anxiety. That means that if you're listening to this and you're an adult in the US, more likely than not, you have some type of dental anxiety, including all the dental team members, right? You know, there's a lot of anxiety in dentistry. And so I will, before we start going through this list, I want to point out the fact that, you know, the jobs that are on the list were scored using 7 component measures: 10-year growth volume, 10-year growth percentage, median salary, unemployment rate or employment rate, future job prospects, stress level, and work life balance. And those last two are the ones that I want to talk about: stress level and work life balance, because I do think that those are interrelated in dentistry because there is so much anxiety. And what I've seen from working with thousands of dentists is that the two things that really can cut a great dental career short are people you work with, meaning if you don't like the people you work with, or if they can be a major stressor in the practice, or just the stress of being involved in clinical dentistry all day, every day. And so we need to manage both of those things. So if you're a dental patient and you walk into a practice, and this, you may have had this experience, we all have in any business we go into, and you can just tell, boy, these people love working together. That was one of my favorite comments that patients would say when they came into my practice was, boy, you guys just seem like you're always having fun. And I was like, yeah, because we are. I mean, it does not need to be stressful. You know, having a team doesn't need to suck. You can actually really like the people that you come to work with every day. And it makes all the difference. And if you're a patient and you walk in and you're like, these people don't seem to like working together. Yes, that, in my opinion, definitely addresses negatively affects the quality of care that's provided there. So having a positive, upbeat, friendly team environment is crucial for both. Yeah, I think it's important to deliver the best quality of care. We talk about that a lot on this podcast, and we put patients first. But the way to put patients first is by treating your team correctly. You know, giving them the tools and skills and space that they need to be able to focus on patients, right? And you can feel that when you go into a practice. I mean, I've been in thousands of dental practices, and you can instantly tell when you walk in the door what the environment is. The culture hits you like a slap across the face as soon as you walk into a practice. You can feel the culture. And I'm not even that sensitive to it, but it's just so obvious. So let's talk a little bit now about the results of the US News World Report and how dentistry ranked. Well, I pretty much gave it away at the top where I said dentists are 10th. So patients are first, dentists are 10th. Uh, and so we, as dentists, rose 37 spots in the last year from number 47 to number 10, due mainly to the high median salary, work life balance scores, and increased employment rate scores. So I think stress is really the one thing that we really should focus on to go from 10 to 1, because it would be my guess, because that's the one part that I think we just don't focus on enough in dentistry. The unemployment rate for dentists dropped to 0.5%. So if you are a dentist without a job, look a little bit harder because it's 0.5%, right? So it's a great profession to be in. And what's interesting to me is that dental hygienist and dental assistant aren't on this list. And I should dig into it a little more, but it's surprising to me because the wages in auxiliary team members has skyrocketed recently. And if dentists have a 0.5% unemployment, then hygienists and assistants should probably be in the negative somewhere because they're just so high in demand. So if you're listening and you're thinking about the reason why you're listening to the Patients for podcast, is you're thinking, I wonder if I should go into a career in dentistry, I would wholeheartedly say yes. I think it's a great time to enter a great profession. I do think that these, if you look at this list, we go number one, software developer, number two, nurse practitioner, number three is medical and health services manager. Four is physician assistant. Five, information security analyst. Six, physical therapist. Seven, financial manager, eight, IT manager, nine, web developer, and 10 is dentist. So about half of these, actually more than half, I believe, are in healthcare. And, and the rest are really focused on electronic services, which you can apply to healthcare. Frankly, that's my job. I'm a software developer in dentistry. That should be number zero. It's the best job in the world. Just kidding. But it is fantastic being a software developer in dentistry. I just love it. It's fantastic. I get to affect many more patients by creating technology for dentists that help hopefully change healthcare for the better. That's the goal, right? But healthcare has probably been tipped the scales a bit because obviously right now in January 2023 when this came out, everybody's thinking about a recession, and when they think about recession, what jobs are going to be good in a recession? Healthcare usually floats to the top of the list. So we probably got a extra bump due to the predictions of what's going to happen. And we all know that those may or may not come true. Oftentimes they never come, they usually never come true the way that people predict them. So, but regardless, it is a stable industry to be in healthcare, and dentist is a great one. I think that there's some, our median salary grew to the number 11 in the best paying jobs as dentists, but that's under attack, as I talk about on this podcast, due to dental insurance playing their games and wage increases and inflation. It's very difficult for dental practices to raise their fees because they're oftentimes capped by insurance, which is a problem for the industry and really can affect patient care. So that's the sort of the concerns that I have for the profession is the profitability of dentists, and I believe it's time to bury dental anxiety. The fact that more than half of adults in the US have anxiety about going to the dentist, I think is criminal. Not criminal meaning it's been overlooked for too long. We as an industry have to focus on that. And if you're a dental patient listening to this podcast thinking, boy, how do I get my needs addressed? I'm so anxious. I haven't been to the dentist in 15 years. I have some needs. Please, not all dentists are the same, right? I laugh when I say that because there's so much variability in dental practices and how they run, which can be problematic, but everybody has a specific focus. And there are dental practices that specifically address patients with dental anxiety. I created the platform Digital Nitrous, that therapeutic virtual reality. It's as effective as a narcotic as reducing anxiety. So you can seek out a dentist that leverages virtual reality that actually pulls you away from the clinical environment, puts you on the beach, puts you in France while you're getting your dental work done. So it doesn't even feel like you're at the dental practice. Reach out to me if you want to find a dentist that's leveraging that technology, or you can go to sleep. If you haven't been to the dentist in 30 years and you have lots of needs, there are dental practices, including my own, where we have a nurse anesthesiologist that comes in and put you to sleep while you have your dental work done. It's a great way to go, and there's no shame in it. If you have dental anxiety, there's ways to get your work done that uh, you can get your work done without anxiety. So please, if you are a patient and anxiety has been keeping you away from the dentist, seek out a dentist that does sedation, that uses therapeutic virtual reality or other anxiolytics like nitrous oxide. There's a whole spectrum of sedation that you can go on. You don't have to just grit and bear it, which is I know happens in a lot of dental practices, but which we're all busy, and most people can get dental work done for without and not have their anxiety be the barrier to them getting the care. But a good percentage of the population does have sort of overwhelming dental anxiety, and it's a shame that that's a barrier to treatment. Let's make sure there's probably a dentist in your area. Again, if you need to find a dentist that does sedation, just send me a note. We can find you a dentist in your area or as close to you as possible that does sedation, that has therapeutic anxiolytics like virtual reality or nitrous oxide, and focuses on your needs. So I think that's key to it, and it's not out of the scope of what we're talking about, because as I mentioned at the top of this podcast, one of the, the negatives of being a dentist is the stress that's associated with the environment we're in. So if you're a dentist and you're looking to reduce your own stress, key to that is reducing the stress of your patients and your team members. So using therapeutic virtual reality, bringing in an anesthesiologist, or referring out those patients that have overwhelming anxiety to somebody that does do sedation. And then also give your team the tools that they need to reduce their stress. Automate your billing, automate your appointment requests, automate, all of the things that just are boring, laborious tasks that your team members are doing all day long. Give them the tools so that they can do what they do best, which is put patients first all day long. So hopefully this has been helpful, and congratulations to Dentistry being number 10, and to my software developers who are listening today for being number 1 on the U.S. News and World Report's 2023 Best Jobs list. And I look forward to seeing you right here next week on the Patients First podcast.